Osteomyelitis. This is the inflammation of bone because of infection caused by the pyogens. Now, the common causative agent for osteomyelitis is gram-positive Staphylococcus, and less common is Streptococcus and Pneumococcus. The primary focus of these agents are the throat and chest. This is important. Immunosuppressant people are mostly affected by these agents, leading to osteomyelitis. There are two types of osteomyelitis: acute osteomyelitis and chronic osteomyelitis. Now, in acute osteomyelitis, we again have primary and secondary. Primary, it occurs in children, especially young boys are affected, and the infection goes through hematogenous source. So, blood is the carrier of this kind of infection. In secondary kind of acute osteomyelitis, the infection is through the open fracture or even bony exposure during the surgeries. Now, chronic osteomyelitis are of three types. One can result from acute osteomyelitis. If acute osteomyelitis is not treated properly, then it leads to chronic osteomyelitis. Another one is caries osteomyelitis, and the third one is Brodie's abscess. Clinical features of the acute osteomyelitis. First, we will know about the acute osteomyelitis, then we will be moving on to the chronic osteomyelitis. So, the clinical features of acute osteomyelitis: the person, especially the young boy, as acute osteomyelitis, primary kind of acute osteomyelitis is common in young boys. So, the boy will present with fever, malaise, swelling, pain, tenderness, and redness is found at the end of the affected bone. The patient will be very much irritable. There is generalized pain in the entire body. The person will refuse to move the limb. There is swelling of the adjacent joints, dehydration, collection of pus in the soft tissues. The medical treatment for acute osteomyelitis will be rest, obviously, IV antibiotics. Antibiotics is given intravenously. There has to be splinting, early pus drainage, rehydration. The organism has to be irradiated. Surgery has to be done immediately, because if the surgery gets delayed, the results will be poor. So the complications, if not treated properly, the complications will be septicemia, septic arthritis, also pathological fracture, because the growth plate or the epiphyseal plate is disturbed. Now, moving on to the clinical features of chronic osteomyelitis. Firstly, there will be the history of acute osteomyelitis. So the patient or the patient party will tell you that the person was having acute osteomyelitis, which has now transferred into the chronic osteomyelitis. Next is recurrent pain and swelling, discharging sinus from the bone, and there is also history of small pieces of bones from the sinus. So this is also known as sequestrum. There is periosteum formation, which makes the bone to look irregular. Sometimes sprouting granulation tissue can also be found from the bony sinus. So irregular bone due to pathological bone formation is there. So knowing about the differential diagnosis, now what other conditions can resemble like acute osteomyelitis? So the differential diagnosis will be acute rheumatic arthritis, acute rheumatic fever, septic arthritis, and hemophilia, because the clinical features of these four conditions are also quite similar to acute osteomyelitis. So the investigations to be done are the blood test, where you can find the neutrophil polymorph leukocytes count has increased, ESR and CRP is raised. The blood culture has to be done, X-rays, aspiration for the culture and sensitivity, and technetium bone scan is done. Now, what happens in this kind of bone scan is, when the medicine is infused, it gets accumulated in the osteomyelitic bone. Findings in the blood of chronic osteomyelitis: the ESR will be raised, the pus has to be sent for culture to find out the causative agent. The radiological findings, we can find thickening and irregularity of the cortices of the bone. There will be irregular bone for obvious reasons. Bone cavity can be seen. Sequestrum is denser than normal, and involucrum, which are the new bony pieces, is visible. Medical treatment includes the surgery has to be done after the new bone is formed. Scooping of the granulation tissue is done. There is saucerization of the granulated tissues, removal of involucrum, there is excision of the infected bone, and antibiotics it goes on for quite a long time. It goes for 2 to 3 months. Complications from the osteomyelitis can be acute exacerbation of chronic osteomyelitis, growth disturbances, pathological fracture, and joint stiffness.